So Bismillahirrahmanirrahim. In this video, we will talk about nose and paranasal sinuses. That is chapter number 15 in BD. So firstly, we'll talk about function. First of all, nose. It is a respiratory passage. As we know, it is an organ of smell, and it has an upper 1/3 portion and a lower 2/3 portion. The upper 1/3 portion, it has olfactory mucosa, which is thin and which is less vascular and has receptors which are known as olfactory cells. Whereas the lower 2/3 portion has the respiratory mucosa, which is highly vascular and it warms up the inspired air. It has two types of glands. One is the serous gland and the other is the mucus gland. The serous gland has its secretion which moist the air, whereas the mucus gland has secretions which are mucousy and they trap the dust particles and other particulate matter. And nose is a conditioning organ because the air that is inspired is warmed by the means of the lower 2/3 respiratory mucosa. It is moistened by the means of the serous gland, and it is cleansed, or it is the bacteria or other substances are trapped by means of the mucus gland. So this is how the conditioning of the air takes place in the nose. Now we have the olfactory mucosa in the upper 1/3 portion. As I told you, it is lined by olfactory mucosa. Also, nose has lateral wall, medial wall. So lateral wall, medial wall, also both of them are lined by the olfactory mucosa, and the roof as well, which is formed by the cribriform plate. And medial and lateral wall, in the medial and lateral wall, the superior concha region is covered by the olfactory mucosa, whereas in the roof, the cribriform plate is also covered by the olfactory mucosa. So olfactory mucosa lines upper 1/3 of the nose, that is the medial and lateral wall of the superior concha, and also the cribriform plate of the ethmoid bone, that forms the roof. Now we will talk about external nose. So external nose has a skeletal framework. It is partly bony and partly cartilaginous. Bony portion is formed by nasal bones, which forms the bridge of the nose and also the frontal process of maxilla. So bony portion forms nasal bones, which form bridge of the nose and frontal process of maxilla. Similarly, there is cartilaginous portion, and you should know there is a superior cartilage, an inferior cartilage, a middle one septal cartilage, and there are certain alar cartilages. Let me show that to you. First of all, you can see the bony process, which is formed by the nasal bone and frontal process of the maxilla. Then we have the cartilaginous portion, which is formed by, this is the superior cartilage, superior nasal cartilage. This one is the inferior nasal cartilage. The one in the middle is known as the septal cartilage, and the one on the sides is known as the alar cartilage. So superior cartilage, inferior cartilage, septal cartilage, and alar cartilages. And the bony portion, the nasal bone, which forms the bridge of the nose, and also the frontal process of maxilla. Also in the superior concha, the medial as well as the lateral wall of the superior concha, and I told you the cribriform plate, all of them, they were covered by the olfactory mucosa that is present in the upper 1/3 portion of the nose. So our external nose has the skin, which is mainly supplied by, for example, this is the skin of the nose. So it is mainly, this portion is supplied by external nasal branch. Then this portion towards the orbit, it is supplied by infraorbital branch, and a little bit lateral, it is supplied by the infratrochlear branch. So external nasal, infraorbital and infratrochlear branches, all of these supply the external nose. Now we will come to the nasal cavity. Nasal cavity is actually divided by the nasal septum into right and left halves, and the nasal cavity begins at the external nose or nostrils. So this is our nose. So at this region we have the external nose or nostrils, and the nose goes behind, and then it ends at this level, which is known as the posterior nasal aperture, or also known as the concha. So it begins at the anterior nasal aperture or nostrils and ends at the posterior nasal aperture or concha, and it is divided by the nasal septum. For example, if you look at nose like this, so it is divided by the medial nasal septum into right and left halves. So nasal septum forms the middle portion or the medial wall of a nasal cavity, and the lateral wall of the nasal cavity is formed by something else or other bones. Now we will talk about the nasal cavity. As you know, it's a cavity, so it will have a lot of things. First of all, if we divide it into like this, so it will have a roof like this, a floor over here, then it will have a medial wall like this and a lateral wall like this. And I told you medial wall was formed by the nasal septum. Now we will talk about the dimensions. First of all, the floor, at this floor level, the dimensions, they are: height is 5 centimeter, length is 5 to 7 centimeter, the width is 1.5 centimeter at the floor, and width at the roof is 1 to 2 millimeters. So at the floor it is 1 to 2 or 1.5 centimeters, whereas at the roof it is 1 to 2 millimeters. It means that at the roof the aperture is very much shortened in the width. Now we will talk about the roof. As I told you, the roof was a little bit shorter and it has a width of 2 millimeters, whereas the length is 7 centimeters. So if we have the roof like this, the length of the roof is 7 centimeter and width is 2 millimeters only, and it slopes downwards in the front as well as in the behind. Now it has a lot of slopes. We will firstly talk about the roof, which has a lot of slopes and it is formed by a lot of stuff. First of all, anterior slope, which is formed by nasal part of frontal bone, the nasal bone and nasal cartilages. So look at this diagram. In this portion we have the frontal bone. So nasal part of the frontal bone, the nasal bone and the nasal cartilages, they form the anterior part of the slope or the roof of the nose. Then we have the posterior slope. Posterior slope is mainly made by so this is the body of the sphenoid. So inferior portion of body of the sphenoid will form the posterior slope. So anterior slope was formed by nasal part of the frontal bone, the nasal bone and certain nasal cartilages. The posterior slope is formed by the inferior surface of body of sphenoid, and middle of this roof is formed by middle horizontal plate, and this horizontal plate is actually the cribriform plate of the ethmoid bone. Anteriorly the frontal bone, middle the ethmoid bone, posteriorly the sphenoid bone. With the frontal bone we also have nasal bone and certain nasal cartilages forming the anterior slope. Posterior slope of the roof is formed by body of the sphenoid inferior portion, and middle is formed by cribriform plate of the ethmoid bone. With that we are done with the roof, which has 7 centimeter length and 2 millimeters width and slopes downwards in the front as well as in the behind. Now we will talk about the floor. So as you know, this was the our nose, and it had the floor which is like length is 5 centimeters whereas width is 1.5 centimeters. So it means in the superior portion, in the roof, the width was less, but in the floor the width is more but the length is less. Now it is mainly formed by certain bones, but first of all we should know it is concave from side to side, and also it is slightly higher anteriorly than posteriorly. So it is higher anteriorly than posteriorly. For example, if you look at the nose, so you can see something like this. So it means it is higher anteriorly than posteriorly. So posterior wall is a little bit downward, whereas anterior wall is higher a little bit. It means that anterior portion is a little bit smaller than the posterior portion in lengthwise. Now the inferior surface or the floor of the nose is formed by the palatine process of maxilla bone and the horizontal plate of palatine bone. Let me show that both to you. So if you look at this diagram, this is actually the inferior process or inferior portion of your norma basalis, and in this you can see the palatine process of maxilla as well as the horizontal plate of palatine bone. The one in pink and the one in orange, both of them are going to form the inferior portion or floor of the external nose. They are the palatine process of maxilla as well as the horizontal process or horizontal plate of the palatine bone. Both of them will form the floor of the external nose. Again, palatine process of maxilla and horizontal plate of the palatine bone. Now we will look at a clinical anatomy. Common cold or rhinitis. It is the infection of the external nose. It may be infective, it may be allergic to like pollen grains, etc. An infection can also take place like bacterial infection, etc. And in the change of seasons it is most common. So this common cold has a clinical name which is known as rhinitis. Remember that. Then we have paranasal air sinuses, which they are saying that from the nose the spread of infection can go to the paranasal air sinuses, and most common sinus which is affected is the maxillary sinus. So maxillary sinusitis is the commonest sinus infection. Then they are saying that nose is related to the anterior cranial fossa. How? I told you that in the upper portion of the nose, or the roof of the nose, you had this cribriform plate in the middle. So this middle cribriform plate connects your nose to the anterior cranial fossa, also to the lacrimal apparatus through the nasolacrimal duct. So in this portion, in the medial most portion, you have a nasolacrimal duct, and this nasolacrimal duct will connect your nose to the lacrimal apparatus, whereas it will be connected to the anterior cranial fossa through the middle cribriform plate. So these are both sites of spread of infection from the nose to the anterior cranial fossa and from the nose to the nasolacrimal duct or the lacrimal apparatus. Now this cribriform plate of the ethmoid bone, so this portion, this middlemost portion, this cribriform plate of the ethmoid bone, it can be ruptured, and when it is ruptured and the meninges, that are the brain layers that are attached to it, the brain external coverings that are attached to it, when this portion, the cribriform plate damages with the tearing of these meninges, what will happen? The olfactory nerve that is present over there, the rootlets that are present over there, they will also be damaged, and in such cases the fluid, that is the cerebrospinal fluid from the anterior cranial fossa, will drip down from the meninges through the cribriform plate into the external nose, and it is known as CSF rhinorrhea. So one thing we studied about was rhinitis, which is known as common cold. Then we studied about the paranasal air the sinusitis, which is inflammation of the sinuses, and most common is maxillary sinusitis. And then we studied how the nose is attached or connected to the anterior cranial fossa and to the lacrimal apparatus. Then we studied how the fracture of the cribriform plate can lead to the CSF dripping into the external nose, which is known as the CSF rhinorrhea. So in the CSF rhinorrhea, you can also see there is a break in the anterior cranial fossa through which the cribriform plate is damaged, as a result of which the CSF will drip down into the external nose, which will be known as CSF rhinorrhea. With that, we are done with the external nose. In the next video, we are going to discuss the middle portion of the nose, that is the nasal septum.